In the meantime, the Vatican says the prognosis for Pope Francis is guarded after suffering 2 new episodes of acute respiratory crisis today.
Guarded prognosis means the Pope's condition is serious and has a chance of improvement, but also a possibility of deterioration. And Circle of Health reporter Denise Dador joins us now with the latest developments.
And today, 2 very scary emergency moments. The Vatican reports Pope Francis is resting quietly after 2 harrowing episodes of respiratory crisis. Doctors continue to be very cautious because pneumonia takes time to overcome, and it's not unusual for a patient's condition to change from day to day. Offerings of prayers, candles, and letters outside Rome's Gemelli Hospital as Pope Francis continues to battle double pneumonia. The Vatican says the pontiff needed 2 emergency procedures to clear a significant amount of mucus from his airways.
Bronchoscopy is a procedure which is a little camera that will be inserted either through the nose or through the mouth, and a physician will go into a patient's lungs and be able to suction up a lot of that mucus that the patient is not able to clear on their own.
Pulmonologist Dr. Goldberg with Providence Mission Hospital says mucus is the lungs' way of clearing infections. A bronchoscopy helps patients weak from underlying illness, but it's not often comfortable.
Your body has natural reactions such as a cough reaction or a gag reaction. So frequently we will give the patient some sedation in order to make it more tolerable.
Following the bronchospasms, the Vatican says the 88-year-old Holy Father is resting quietly and getting mechanical assistance to help him get more oxygen.
He is on what's called non-invasive ventilation, meaning it's a machine that is applied via a mask over the nose and mouth that pushes in that air in order to help the Pope breathe.
The Pope has spent 18 days in the hospital fighting pneumonia, which doctors say is not unusual for someone his age and health status. A chronic illness led to the partial removal of part of one of his lungs when he was young. The Vatican says the Holy Father remained alert, oriented, and cooperative at all times, and that his prognosis remains guarded.
Things can change minute by minute, hour to hour. People can recover or they can deteriorate fairly quickly from a multitude of different issues, and part of critical care is trying to anticipate those possible complications and address them before they become an issue.
Dr. Goldberg says it's not unusual for critically ill pneumonia patients to require hospital stays of 30 to 40 days. While we don't know exactly what led to the Pope's pneumonia, we're seeing a second wave of flu infections here at home. Dr. Goldberg reminds us that a flu shot can lessen the chance of it developing into pneumonia. Denise Dador, ABC 7, Eyewitness News. Ellen, that's the latest.
All right, Denise, thank you so much.